To what I think is going to be the best panel of the day, because we're talking about minors, and you can never know enough about these minors. So we're going to start out today by embarrassing our resident PhD, Dr. Jake Black, down at the end. Can you please tell us a little about, introduce yourself?
Yeah, my name is Jake Black, PhD in chemistry, been in the industry since 2015. We recently, co-founder and CEO of Treehouse. We're out of Longmont, Colorado, a producer of bulk hemp-derived ingredients, and we do a lot of research and development. We recently merged with Next Frontier Brands, and we're continuing to do all the same work we were doing, and I'm kind of moving more into a scientific role as the Chief Science Officer there. So, brief introduction.
All right, next to Kyle.
Good morning, everyone. So my background is in biochemistry, neuroscience. I did some time at NYU School of Medicine, working in a cardiology lab, studying the development of atherosclerotic plaques in human aortic smooth muscle cells. But I thought cannabis was a lot more interesting. So then I got ahead and started a THC remediation company, and since then, that initial venture has kind of morphed into Colorado Chromatography, where I am the Chief Operating Officer, and our focus as a company is the manufacture of wholesale minor cannabinoids, so CBN, CBC, CBG, THCV, CBDQ, and all kinds of interesting minors we have in the pipeline that you've probably never heard of.
Colby.
Hey guys, good morning. Colby Watkins. I am the founder of the CBD and Cannabis Professional Business Network, which is currently the largest network on LinkedIn for CBD and cannabis with 25,000 members. Also co-founder of a company called Where's Hemp, traditionally a data house, but helping brands come to market, navigate the CBD space, understand what their formulations and what they're putting in their materials. Thank you.
And Peter.
How's everybody doing this morning? My name is Peter Holsworth. I was the CFO, CIO of BioTrack THC when we launched the state government regulatory tracking system for Washington, Illinois, New Mexico, New York, and Hawaii. I've gone on to do a bunch of other things, but in relationship to minors, I have a 10,000 pound a day cold ethanol extractor in Mayfield, Kentucky called Red Vault Extraction. I sell massive amounts of minor cannabinoids alongside this guy, and I make shoes.
Now, can everybody hear them, or is there someone that needs to be talking louder? Looks like we're good. Okay. All right, so we are going to start out talking about minor cannabinoids in the emerging market. And so, Colby, can you just kind of give us a little overview?
Sure. So minor cannabinoids is emerging in an emerging market is just that, where it's an emerging market on top of an emerging market. So there's so much to be discovered, so much to learn in terms of the efficacies and use of these minor cannabinoids, and in terms of setting a standard for how these formulations are going to come about, in terms of precedent for how they're going to be used, and for where they're going to fit into the pieces of the puzzle in the cannabinoid world. There's a lot of gray area, and there's a lot of challenges surrounding the whole market. There's not standardization sets yet. There's not standardization within labs yet. So it's an interesting place. It's an interesting thing to learn, and a lot of the challenges surround educating the actual consumers themselves on what these minors do by themselves, but also how they interact with each other from an entourage effect standpoint, as well as just adverse effects as well. So a lot to be learned from everyone on this panel, I'm sure, as well, but just in the whole market itself in the minor cannabinoid space.
Okay, Jake, we talked a little bit yesterday about all these multitude of new cannabinoids coming out, and kind of comparing them and contrasting them a little bit with CBD as the major one. Can you kind of touch on some of these cannabinoids and how to know if it's the right cannabinoid that you're using, and also the wrong cannabinoid?
Yeah, so there's, of the known compounds, minor cannabinoids that the plant makes, there's over, I think, 140 now at this point that have been identified. I'd say 138 of those we really know nothing about. Primarily, all the medical and scientific research has been on THC and CBD. Certainly, new stuff is starting to come out on a lot of the other ones that we're talking about here today, but very nascent. And so, honestly, from a scientific perspective, it's hard to say what specific minor cannabinoids will do, what treatments they'll be good for or bad for at this point in time. That said, there's actual government NIH funding going into this now, and just to kind of paint the picture of the potential efficacy of any one of these compounds, the only difference between CBD and THC is one chemical bond, and that kind of changes the three-dimensional structure, but it's just one bond. They're identical in every other way, and so that bond has obviously massive effects on the psychoactive efficacy between the two compounds and their medical kind of treatment. And so all of these other compounds have very different structures, and the potential for treatment within the endocannabinoid system is really huge. And so I think everyone up here is very excited about that, but it's also going to probably take years and years of hard scientific research to figure out what all these compounds are doing.
And Kyle, you had talked about a preclinical CBN paper?
Yeah, so there have been some preclinical studies done with regards to CBN or cannabinol, and while those studies did not end up going all the way to full clinical trials, during the preclinical data, it was really interesting. CBN actually demonstrated a extremely high safety profile relative to other drugs that they were trying for that same purpose. So as of today, these minor cannabinoids, while they are still incredibly understood, as Jake was talking about, and there is mountains and mountains of research to do based on their own individual interactions themselves as an isolated compound, and as you start making broad spectrum mixes and full spectrum blends, CBN, as it stands currently, appears to have a very high safety profile.
That's good to know. Kind of important. All right, Peter, what's your take on the emerging market of these minor cannabinoids?
Yeah, I love them. I mean, if you look at the commoditization of what took place in 2019, 2020 in the CBD isolate market, we just fell through the floor, right? So we were a couple of years ago trading CBD isolate at over 1,000, maybe the good old days per kilo, and went all the way down to below 300. So the conversion of CBD isolate into D8 is literally what's saving the market supply right now. If we have any impending regulation on the psychoactivity of D8, we're looking at another collapse of the cannabinoid isolate market again. If we're prevented from doing these conversions, so I think D8's a really interesting gray market right now that's kind of like run as fast as you can to get the money while it is. D10 as well. I think there's probably going to be impending regulation around them coming because they have a psychoactive effect on your homeostasis. So anything that does that, we're going to have some sort of governing hand about. And I just say, as far as the minors are concerned, we just have such little idea yet. I mean, as you mentioned, we're testing for just a couple out of hundreds. We have really no idea how they affect our endocannabinoid system yet. So stick to flower. But D8 and D10, I think they're going to stay around. They're just going to have some sort of regulatory stance brought to them in the next 12 months.
Yeah, and we're going to talk about that in a few minutes. And from what Colby has told me about, you're quite the expert on the D8 gray area. So we're going to come back to that in just a sec. Colby's like, yep, gotcha. Okay, so one of the important things about all these new cannabinoids, like they were talking about, is finding out what they are, how they work, and that whole process. And so Jake is going to talk about the R&D process and also touch a little bit about papers, studies, trials, and differentiate between those a little bit.
Yeah, absolutely. So kind of big picture, right? I mentioned that we've known for a good while that there's these 100 plus cannabinoids out there. That said, accessing a lot of them from the plant is very difficult. They've been discovered, but to kind of get appreciable quantities, you have to move into things like synthesis, and I think we'll cover that at length with the D8 as far as converting one cannabinoid to another. But most of the other cannabinoids, I'm of the opinion that you're going to have to do a lot of synthetic chemistry to access them in any appreciable quantities. And so accessing them is kind of the first step in the R&D process. Once you have the compound and you've purified it, you then usually go to kind of cell line receptor-based screens. And so that's kind of the different receptors of your endocannabinoid system, or a lot of the ones Kyle talked about yesterday. You can put them, on a petri dish sort of thing, and start to see how different molecules bind to those receptors. That starts to give you a picture of how they could compare to other known entities, whether it's CBD, THC, or even other drugs, Advil, acetaminophen, anything. And so then you do that screen. If you find some promising hits or information, you then progress kind of to probably a mouse model or maybe some cell line studies. That is all, really that's just kind of R&D science. It can start to move into clinical, preclinical as you move towards kind of mice. But I kind of caution people that, you'll see, paper published says CBG is good for chronic back pain or something. And you kind of have to view it in the same sense of, on the news, you'll see like coffee can increase your risk of cancer, coffee decreases your risk of cancer. And those are all kind of like one-off studies where they look in a very kind of small subset of, mice or cells and stuff like that. But that's very different than a full clinical trial, which takes a lot more time, money, and effort to really prove the efficacy of a specific compound for a disease state. And so I don't think these minor cannabinoids should all go down that drug pathway. I think, in my opinion, they should fall more into a dietary supplement like vitamin E, vitamin D, things that we know kind of can help you in different ways. You don't really get them prescribed per se to treat a specific disease, but you can take them for wellness. And most importantly, you figure out that they're non-toxic, because that's kind of one of the key components is you don't want to be taking things that are actively harming you. So that's an overview of the kind of complex process and how I view it, at least.
And it also shows the importance of these safety studies, because, like you said, you don't want to take something that's going to destroy your liver or something like that. Kyle, can you touch on, we're going to move over to Delta 8 land now. Kyle, can you touch on the paper in J Natural Products on Delta 8?
Yeah, I'd be happy to. So I don't know if the audience is aware, but about October, September of 2020, there was a new paper published in J Natural Products, which essentially described what a lot of people consider an issue in the industry. Some people consider it a boon for the industry. I'm pretty neutral on the whole Delta 8 thing. I think it's interesting more than anything. But there was a paper published that essentially explored over a dozen different ways to create THC, both Delta 8, Delta 9, from CBD. They're used a number of different catalysts. Obviously, they're all acid catalysts. You had a very, very large subset of data to pull from. And so I think it's interesting to see that, it's not just the big manufacturers of Delta 8 that have these secrets, quote unquote. They're open knowledge. They've been published in papers in J Natural Products, and we have expert scientists throughout the country working on these different processes. And just as an added caveat, there was another paper published, I believe, in 2018 or 2019, which was essentially trying to blueprint the manufactured THC from CBD so that they could try to backtrack illegally made THCs and figure out exactly what catalyst they were using, what solvent they were using, in order to basically give a fingerprint to different converted THCs based on their byproducts, so that you can determine how that THC was synthesized. I thought that was something that's very interesting, and it's a good thing for the industry to have real scientists and full university scale resources approaching these questions.
Of course, I think the easiest thing would be if there was just federal legalization.
I would have to agree with you on that one.
I mean, it would put a couple studies down, because they wouldn't be focusing on it so much, But yeah, just legalize it and let's be done with it. We don't have to deal with the whole Delta this, Delta that. Just do what's right, do what works for you. Okay, Colby, I would like for you to just talk a little bit about the status of rulings with Delta 8, and then we're going to throw it to Peter to go into gray area.
Sure. I mean, the status of Delta 8 is there's really truly no actual set in stone precedent and process for Delta 8, whether that's being transporting or using into products, using from a federal standpoint into any food and beverage. It is such a gray area, which is why you're seeing such a burst of it in the CBD and cannabis and the hemp and cannabis world. It's different in the sense of you have THC Delta 9. It can only be marketed within states that are legal for THC, and even then they have to sell within their own state. THC Delta 8, it can be marketed to all smoke shops across the United States. So from a company-wide standpoint, it's adverse risk to be able to have a product that is psychoactive, that has a market share that is nationwide. And that's why I think we're seeing such a burst of THC Delta 8 is because Delta 9 is clued to by where you are by each state. So there's a gray area in that sense, and then in the sense of the actual product itself. Standardization for testing in general has been a problem within the hemp space, and that's just industry wide. However, particularly with Delta 8, Delta 10 is emerging into having the same type of problem. But because there is no standardized lab testing, people tend to use the labs that they like and labs that they know. But each person has their own lab that they want to use based on their previous experience. That doesn't mean that lab has set a true standard of calibration for actually testing Delta 8 versus a Delta 10 versus THC Delta 9. So what we're having indiscrepancies across the industry from lab to lab. So you can send in a sample to one lab and you'll say, okay, this has non-detect, which obviously doesn't mean no THC Delta 9, but under 0.1% THC Delta 9 in the US. Send it to another lab and it will have 5% Delta 9. And it's that differentiation in terms of standardization that's harming the overall industry itself. And it's a gray area that before we get to that everything legal standpoint, that gray area has to be determined, set, and defined so that there's a standardized process and a universal way to apply cannabinoids industry-wide, not just Delta 8.
And just to piggyback a little bit off of what Colby was just saying, if there was standardization within the testing labs where they had to run the same methods for the same compounds when they're looking for them and quantifying them, Delta 8 would not likely to be in discussion right now. It wouldn't be a debated topic because it is likely that the majority of the Delta 8 that is being sold and consumed right now is in fact hot for Delta 9 THC. And if there was standardization, we would not have to worry about government oversight trying to come in and mess up the Delta 8 industry. It would allow us to let those labs that can truly make a compliant Delta 8 product, it would let them have the lion's share of the market. Whereas right now with the lack of standardization, the kind of stuff that's being produced and called compliant and sold in gummies as edible grade is terrifying sometimes.
And not to pick on Delta 8, but Delta 8 in itself is not the most stable molecule. So if Delta 8 oxidizes, it turns into Delta 9. So I could have bought my Delta 8 and I'm going to put it in my gummies, and it sat on my shelf for a month and it's oxidized now. When I tested it at this point, it was 99% Delta 8, probably 95% Delta 8, and non-detective THC Delta 9. By the time that I actually put it into one of my products, it could have degraded into THC Delta 9 and oxidized into THC Delta 9. And because it's literally changing while on your shelf, it's really hard to set a precedent for standardization.
And you're going to test, like if you're working in a federal job and you have to undergo like THC testing, Delta 8 is going to pop.
Right, exactly.
Yeah. All right, Peter, what are the ups and the downs, the good and the bad of this gray area?
Well, the good is getting's good while you're getting it, right? So, money in your pocket. It's literally saved the CBD isolate market. Before that, we were rising to the bottom of the prices, and a lot of the institutions were going out of business because they had financed their operations at much, much higher levels for the commodity. And at the end of the day, this is a commodity. We are in a commoditized agricultural game, and the gray market that exists right now just gives us a window. But it is a gray market, and it is something that is going to have regulation in the near term. the risks are just what these gentlemen that are much smarter than me just said, is that without a standardization of testing or a homogenization of standardization across state lines, we're going to find different qualities, from a clear to an amber to a gold. And you're going to find people that are coming to the market just trying to make that money that might not have their SOPs down. I think a couple weeks ago, if you guys are familiar, there was an event in Orlando where 17 people had to go to the hospital because there was a bad batch of dead Delta 8 running around. Things like that happen. We're going to see more and more regulation come to this market faster than we anticipated. And whenever we're doing, in an emerging market like this, unless we, as the community and the operators ourselves, put a standardization to hold ourselves accountable to it, we're going to find that the government that doesn't really understand this market is going to come in and regulate it, and we might likely find that Delta 8 or Delta 10 get pushed into a regulated market. So the gray market is an opportunity. It also presents risk. Buy your stuff from smart guys like these guys, with a PhD at the end of the row here, and trying to avoid the classic mistakes of our cannabinoid industry, of the fraudsters that are out there.
Yeah, that's one of the things is that, like, if you're not knowledgeable, first of all, get knowledgeable before you go into the business. I mean, because like you said, I mean, this is a great opportunity to make some money. But that's the thing, is that this is a great opportunity to make some money. So you may get bad actors that have no clue what they're working with, and then, their product does what their product does. And for people who aren't educated as users to Delta 8 and don't know what the results are going to be from using Delta 8, that's another scary thing, because they could put themselves in a situation that maybe they don't really want to be in. So we're going to move to the challenges of minor cannabinoids. So Jake, how about we talk about consistency, efficacy, and that whole safety with these minors, and go from there.
Yeah, and I think that Delta 8, not to keep on this, but I think it's a good case study in how I view minor cannabinoids. And so in this case, it's easy to make Delta 8 from CBD. So now you're getting into the synthesis of a minor cannabinoid. You get into probably some semantics, but in my mind, that's definitely a synthetic, it's been synthesized. People will market it as, oh, it's hemp derived because we took the CBD from the hemp and then we turned it into Delta 8. But if, like Kyle was mentioning, if you looked at the papers for what they're using to convert one to the other, it's very much synthetic chemistry. So now you're dealing with a synthesized molecule, and whenever you're doing that, and I'm of the opinion that to get to most of the other minor cannabinoids, you're going to have to do similar synthetic chemistry, which is fine if you do it correctly. And we've just touched on that. One of the things I don't think really has been mentioned is we talked about the standardized testing, trying to understand the purity, the true purity, as well as THC content, changes, oxidation, isomerization over time. That's all complexity. But one thing that hasn't been touched on is you only can see what you test for on these COAs. So they usually test for a panel of cannabinoids and then maybe heavy metals and residual solvents. If they're using crazy acid catalysts to turn CBD into Delta 8, that's not going to show up on any COA unless you're specifically looking for it. And no labs that I'm aware of are looking for any of these acid catalysts. So even if you have a 95% pure COA with no other cannabinoids, no Delta 9, what's that other 5%? That's a pretty important question. How much of the residual acid catalysts are left over? What are those acid catalysts? Are there other unknown compounds that were part of the synthesis making up that 5%? What's the toxicity of those compounds? And none of that's showing up on anybody's COAs. And really, if you don't even know to ask that question, like how would you know to look for that when you are buying an ingredient or a product? And so in any of the minor cannabinoids, those are all the things that have to be addressed. And to go back to the regulators, I mean, the FDA has a clear path for this as far as you're able to synthesize naturally occurring compounds. We all, whether knowing or unknowing, consume them probably on a daily basis. A lot of the vitamins are synthesized. They're not actually derived from plants. Nicotine, caffeine, all those things can be synthesized, normal pharmaceuticals. And so there's a way to do it safe and make the molecules identical to the natural compounds and make them safely. But the FDA has pretty stringent requirements on studying all of these things I just mentioned, all these impurities and unknowns, to prove that it's safe and able to be on a shelf. So, you know, you walk into Safeway, a gas station, you grab something off the shelf, you're not asking yourself, I wonder how this was made and what the impurities are and what the COA said and is there heavy metals. Because the FDA is not regulating this industry, you can't do that with any hemp-based product, I would say. And so I personally wouldn't go into a store and grab a Delta 8 product off the shelf and put it in my body because, you know, you can trust Safeway because in the system, the FDA to some degree, but they're not touching our industry right now, and that's scary to me. So,
Kyle, can we touch on the challenges in manufacturing these new cannabinoids that we're working with?
Yeah, I'd be happy to. So just to touch a little bit on what Jake was saying, Delta 8 is a cannabinoid that's made synthetically, but in the grand scheme of synthetic chemistry, it's a simple process. It's something that I wouldn't recommend you could do this, but you could make it in your kitchen with some lemon juice and moonshine. It's nothing special. A lot of these other cannabinoids require a significant amount of infrastructure, a significant amount of training, significant amount of expertise to do them safely. They use catalysts that a lot of you probably haven't even heard of and definitely wouldn't want to consume. So I think just kind of to echo what Jake is saying, the importance of getting your minor cannabinoids from a company that is doing things correctly, that's GMP certified, that's working on these different safety profiles, that, you know, works with universities to get NMR mass spec data beyond just the typical HPLC or GC data, because all they're looking for is cannabinoids at these third-party labs. And I can tell you that a lot of these byproducts are not cannabinoids. They're not going to show up, and you don't want to take them. So just in terms of the challenges with production, the safe production is significantly more challenging than just trying to produce it in a garage. So you got to be very careful who you're choosing to get your minor cannabinoids from. But to take it a step further and talk about the challenges of being a minor cannabinoid manufacturer in the industry in its current state, there's just so much that people don't know about these minor cannabinoids. Like they were saying, it's a emerging market on top of an emerging market. So it's so brand new. No one's ever heard of some of the cannabinoids that, you know, we've been working on. And customer education is key, and consumer education is so important to try to help people understand what these cannabinoids are and why they want to use them. So as a manufacturer, you know, it's our job to make sure we're making safe molecules, but also our job to make sure that we're educating people on the proper way to consume these molecules. And to touch on what Colby was saying, a lot of these compounds are a lot more sensitive than your typical CBD or CBG or THC, where they need to be sealed under inert gas or stored in cold environments, or they can't be exposed to the sun, or they will degrade. You know, for example, CBC is a cannabinoid I'm sure that you've all heard of. But did you know that over the course of a few months, it will actually degrade into THC? So if you buy pure 99% CBC, in 3 months, that CBC may be hot for THC just due to natural degradation. These are the kind of problems that a lot of people don't consider, and it's a very different field than your typical major cannabinoid manufacturer. That is a much more of a cut and dry process where there's no hidden. There are a few hidden trade secrets and tricks that people can do to cut costs, but almost everyone that I know of in the industry knows how to make crude, they know how to make distillate, they know how to make isolate. But what's interesting about these minor cannabinoids is there's 1,000 ways to skin a cat. There are multiple synthesis routes that you can take to get to a final product. And what's going to be interesting over the course of the next few years is we're going to see the companies that have the proper compliance put in to where they can create safe products, as well as the scientific strength to have the most efficient processes that can produce them at scale for the cheapest cost. That's really what the minor cannabinoid market is all about.
And just to piggyback off that, there's also no precedent set on how these cannabinoids are going to act together, right? We're talking about isolates, which means isolating an individual cannabinoid, CBN, CBG, CBC. Put these together in a room, and they can have adverse effects. Just as if you were to take Tylenol with another compound, they can naturally have adverse effects. And because there's been no precedent on how they're going to interact, and it hasn't been adopted universally yet in terms of the amount of market share that these cannabinoids have shared, it's a dangerous world to jump into and just make assumptions when you're going to be taking a specific cannabinoid itself.
Peter, your thoughts? I saw you nodding a lot.
I just like hearing these guys talk. I mean, they're so much smarter than I am. I just try and soak this up like a sponge. The converted markets right now, I think they're great. I mean, they're wild. They're the Wild West discovering what D8 is. Who is taking D8? Raise your hand. Wow. Okay. So a couple of you, right? I mean, did you find it was kind of a downing, an indica-like experience opposed to a sativa, if you will? Interesting. So, I mean, I think we're going to find more and more around the homogenization, standardizations of production. The guys that are converting right now, really, you're right. Everybody has different SOPs. Nobody does it the same way, it seems like. We implement software solutions within our extractor that give us the same processes every single time. The issue with this industry is because of that bifurcation of everybody's processes, no one's producing a consistent consumer experience. And so when you don't produce a consistent consumer experience, largely in part because you don't have controls over your inputs. And when they're not having any controls over your inputs, you're like spraying it like a male cat. Why does somebody go to Tiffany's opposed to JCPenney to buy a bracelet for their girlfriend? It's because that little box, they know that that's a type of quality, right? That little blue box or turquoise box. And without these consistent SOPs to control your inputs, you're going to wind up with product that goes all over the place, from an amber to a gold to a clear, right? And you're going to consistently find people having different experiences. I had some D8 gummies, I think last week at some other event, and it floored me. I woke up like I had 12 shots of tequila, and I just, I was just hammered in the morning. It was tough to even get out of bed. And I had, D8 gummies a week later. That felt fine. The potency was all over the place. The consistency of the D8 was all over the place. You're right. I had no idea what I was consuming. And, we were just throwing our dice on the roulette table. So.
All right, well, we're just going to take a minute each. We'll start with Jake at the end. Your favorite minor cannabinoid and why?
Oh, probably like CBL because of its chemical structure, which is a weird thing. And I don't know. We have no idea what it does, how it will work. But it's an interesting.
Such a chemist answer.
Yeah. That's my answer.
Hey, it's a good answer. I'd never even heard of CBL before. Kyle.
I would say that my favorite cannabinoid that I'm most excited about on the market right now is going to be CBN, and that's because of its receptor binding profile. You can see it binding to a lot of the same receptors as THC, but in a lot of different ways. So I think there's a lot of interesting therapeutic potential there. But in terms of an upcoming cannabinoid that I'm really excited about, I think THCP is going to turn this whole synthetic cannabinoid market on its head.
Oh, one more thing though. What the heck is CBDQ?
Right. So CBDQ is CBD hydroxyquinone. We like to refer to it as the most well-studied cannabinoid that no one's ever heard of. To keep it brief, there have been a number of studies on it over the past 2 decades. It's also known as HU331. And this cannabinoid has been shown in scientific literature, I'm not making any medical claims up here, to be a very potent anti-cancer agent. It is a topoisomerase type 2 inhibitor, which is an enzyme that's found in all of your cells and is used in the process of DNA replication. So it is very interesting in its application, and the big reason that we want to try to get CBDQ to market and into the product formulators' hands as a natural product is because we have a feeling that Big Pharma is going to try and snatch this up from our industry and kind of hoard it for themselves. So we're trying to get it into a more natural market to establish it there before pharma has a chance to steal it for
Yeah,
themselves.
and that is a real process. Getting it out there, getting
my
it.
hero.
Yep. Colby, what you got?
So my personal favorite minor cannabinoid is going to be THC Delta 9. However, the most exciting cannabinoid in my world, I would have to agree with Kyle, would be CBN. For many reasons, right? It's just the applications of use are endless. The what it represents currently in terms of how it's going to be consumed. I mean, there's been talks of it replacing like a Xanax or something like that, right? It's also a minor cannabinoid that, in my opinion, probably has the biggest punch, right? You need 3 milligrams of CBN and you can be floored, whereas traditional CBD, talk about 25 milligrams or something like that. So I would say CBN is the most exciting for formulations and taking upcoming market share from Big Pharma in my world.
Peter.
Well, I guess my favorite natural compound would definitely be DMT. But I would have to say out of cannabinoids, probably CBG for the neurocognitive restorative properties, CBC for your gut. But I like to get high, so I'd probably do D8, D9, T10, somewhere around there.
Love it. Are there any questions out there? Because we can talk forever. Yes, sir. You can. We're not going to be able to hear you. Would you mind going to the mic there? Thank you. I got to figure out which cannabinoid is good for hearing because mine's shot.
Who mentioned about to the two chemists, I think, Doc?
A little louder, please.
How will Big Pharma lop up the market on what's their threat to this whole thing that everybody's getting into?
Yeah, I can jump on that first. So CBD is a good example. So you cannot patent a known naturally existing kind of compound in and of itself. And so nobody can just patent the structure of CBQ, CBG, CBD. You can patent a specific use case of a molecule. And so Epidiolex, which is the pharmaceutical version of CBD, has been patented by GW Pharmaceutical, who recently merged with Jazz Pharmaceutical. But they have a patent that says that if you're using pretty much CBD isolate and then administering it, it's violating their patent. Right now, the specific use cases are for seizures and epilepsy. That said, that's why in the United States, the FDA considers CBD a drug. So the FDA says you cannot put CBD in food products and it needs to go through the pharmacy. And that is its stance, and they've not changed that. And so it would take congressional kind of actual Senate Congress vetoing that to overrule the FDA on that standpoint. But any of these minor cannabinoids could go through that route. And it is honestly I've fallen in between in the gray area of the ethics and morality here, because it takes a lot of time and effort and money to study something like Epidiolex. Took 15 years, clinical trials. They've helped a lot of people, and the drug, as bad a rap as the pharmaceutical industry gets, it does do very rigorous and expensive science. And we've seen with the vaccines, they can whip out really effective things in years if they're unfettered. That said, they're also well known to monopolize it and want to make as much money as possible. And how does advancement of medical research get done if pharma and universities aren't willing to fund it because they're not going to get their return? So we may never know what any of these compounds do if they just kind of abandon them and are like, well, we can't patent these drugs, so we're not going to study them, and then humanity suffers in that sense because we'll never know what a lot of them do. But that's the big concern, I guess.
I'll give you a tip on how to protect yourself away from Big Pharma. My former law firm used to represent Pfizer, GlaxoSmithKline, 17 of the Fortune 50. So when you're taking a look at formulations and you're taking an actual use case study, this will do, in order to make a dietary claim or be recognized as safe, the FDA has given you the pathway already about how they're going to regulate cannabinoids. So either a new dietary ingredient or a generally recognized as safe designation from the FDA will allow for you to actually make an efficacy claim. So this puts me to sleep, or this actually removes inflammation from my hands, or whatever it is. Without that new dietary ingredient, you can't actually say on the box this does anything or put any kind of medical claim whatsoever. The generally recognized as safe will allow you to actually have it safe for human consumption or pet consumption. What he's speaking about Epidiolex is a new drug application, which is a 10-year, billion-dollar process. It takes way too long to achieve. But if you can achieve those with a patented cannabinoid profile. So my law firm, Zuber Lawler, was the first to ever patent a strain plant patent in the United States. Coupling that strain plant patent under certain growing conditions with the designation of a new dietary ingredient will ensure that you have something that will last. Because, big box retailer like Walmart or Target or anything will never take the reputational risk they have for their billion-dollar brand on something that doesn't have these designations, right? They just won't allow you on the shelves. They won't take the risk of some backlash happening. But if you can take a patented approach towards a cultivation, controlling your inputs, resulting in a lipid, fat, lipid, cannabinoid profile systematically like Bedrocan does every single time, and then apply that for a new dietary ingredient with your formulation, you've got yourself something that's rock solid. So that's one way to really protect yourself against big pharma, or just make yourself an acquisition target. But let's face it, there's no way, shape, or form any of us in this room are going to stop big pharma from doing what big pharma wants to do.
100%. Any other questions?
Thanks, guys. And we mentioned a couple times about educating the consumer in this market. I'm curious, how do we go about doing that as an industry, and what does that actually look like?
That is an excellent question. The hardest part of marketing is educating anybody, right? Having somebody spend enough time on your subject matter, comprehending your subject matter to understand it in a way that they can then go and tell somebody else about it. How that content block is consumed or achieved can be done in a lot of ways, right? So it's going to be something where you spend a big budget on constantly being there and constantly being seen as such. It can also be done through efficacy, right? So how has this previously been used? But if you're going in that direction, that means somebody has to take the time to read those use cases. So it's such a loaded question, because I'd love to say this is the answer to doing it, but it's as the market matures, as people have seen common knowledge, as standardization comes, and also as precedent has been set, the market will naturally start to educate themselves on what these uses are. Unfortunately, when you're dealing with an emerging market and educating that market, there's a lot of trial and error. So a lot of people are going to be taking cannabinoids that they work in different ways for a lot of different people, and there's going to be a lot of studies on the different use cases and the different ways in which they've been consumed.
And from our perspective, I think a lot of companies end up getting the cart in front of the horse when it comes to market education. It's like Jake was saying, you'll get one claim that CBG, you rub it on your head and it'll make you a foot taller in 1 year, right? But if there's one study that says something, that doesn't necessarily mean that is the truth and that is exactly what this compound does. It's just the tip of the iceberg. So I think a lot of companies really fire up their marketing a little bit too hard, and they don't have the actual data and science to support what they're trying to push. So the approach that we like to take is we like to, analyze all of the existing literature, the science, the journals that's already out there, break it down for our customers, and present it as is, so they can have the most up-to-date understanding of the cannabinoids as they exist, because that's all we know. We obviously like to add a little bit of marketing spin in there to make it appealing and make people want to buy it. You have to do that as a business owner. But I think it's really important not to let the marketing machine take control of customer education, because that's not where the minor cannabinoid knowledge base is at. And it's important for us to not push past the bounds of what we understand and know currently.
Exactly. Yeah. No claims, because claims are dangerous. Well, our time is up. So we appreciate y'all coming to learn a little bit about minor cannabinoids, and I hope you learned something.
Thank you.